Gastroenterologist reveals the 5 causes of bloating and IBS. Dr. Bulsiewicz. Do you often feel bloated or struggle with stomach discomfort? Have you ever wondered what causes irritable bowel syndrome or IBS and how to manage it better? You're not alone. Studies show that nearly 20% of people worldwide experience symptoms of IBS, and bloating is one of the most common digestive complaints. In this video, we have Dr. Bulsiewicz, a renowned gastroenterologist, best-selling author, and expert in gut health. With years of experience helping people improve their digestion, Dr. Will is here to break down the 5 key causes of bloating and IBS in a simple, easy-to-understand way. Your gut plays a major role in how you feel every day, from your energy levels to your immune system. But what's really going on inside your digestive system when bloating and IBS flare up? Could your diet, stress, or lifestyle be the culprit? Stick around as Dr. Will shares valuable insights and practical steps to get your gut health back on track. Let's dive in. The first major cause of bloating is a damaged gut. Think of your gut as a bustling city full of microorganisms, including bacteria, yeasts, and even viruses. These invisible inhabitants, collectively known as your microbiome, work together to keep your digestive system running smoothly. Among them are even some beneficial parasites like blastocystis, which play an essential role in gut health. When this ecosystem is in harmony, your gut is resilient. It digests food efficiently, protects you from harmful pathogens, and even supports your overall health. For example, a healthy gut can handle an indulgent meal, like spicy Mexican food, without much trouble. But when the balance is thrown off, your gut becomes weaker, leading to bloating, gas, and other digestive issues. A damaged gut doesn't happen overnight. Common lifestyle factors like frequent antibiotic use, processed foods, lack of exercise, and poor sleep disrupt the microbiome's delicate balance. These issues are widespread in today's society, particularly in places like the US, where fast-paced lifestyles often lead to neglecting healthy habits. A disrupted gut environment can lead to conditions like irritable bowel syndrome, or IBS, and small intestinal bacterial overgrowth, or SIBO. Both conditions share symptoms like bloating, cramping, and gas, which can significantly impact daily life. So, how can you tell if your gut is damaged? Dr. Bulsiewicz suggests 3 key indicators. 1. Bowel movements. Healthy stools should be soft, sausage-shaped, and easy to pass. Deviation, whether constipation with hard, lumpy stools or diarrhea with loose, watery stools, can signal an issue. 2. Digestive symptoms. Persistent bloating, gas, or stomach discomfort after eating are red flags. If your body struggles with digestion consistently, it's a clear sign of gut imbalance. 3. Associated health issues. Conditions like obesity, insulin resistance, type 2 diabetes, or hormonal imbalances often coexist with gut damage. For instance, someone might present with anxiety, polycystic ovary syndrome, or PCOS, and bloating simultaneously. Although many commercial stool tests promise detailed insights into gut health, Dr. Will advises against relying on them. Most are not scientifically validated and can cost hundreds of dollars without providing reliable information. Instead, focus on simpler and proven methods. Observe your stool patterns, monitor your symptoms, and evaluate your overall health and medical history. This holistic approach often provides better clarity than expensive and unverified tests. Your gut's health influences more than just digestion. It's deeply connected to your metabolism and blood sugar levels. The gut microbiome affects how your body processes food, which can lead to significant variations in how you respond to different meals. This link between the gut and blood sugar is critical but often overlooked. Poor gut health can contribute to issues like insulin resistance and difficulty managing glucose levels. Moving on, the second major cause of bloating is bowel motility issues, particularly constipation. Constipation is a surprisingly common but often misunderstood cause of gas and bloating. Dr. Bulsiewicz explains that nearly everyone with constipation experiences bloating, even if they don't recognize the connection. Many people believe that having one bowel movement a day means they aren't constipated. But the real issue lies in incomplete evacuation. If you're straining, feeling like you haven't fully emptied your bowels, or needing to return to the bathroom soon after going, you might still be constipated. When bowel movements don't completely clear the system, stool begins to accumulate, creating discomfort. This incomplete evacuation can result in gas and bloating, even in individuals who don't identify themselves as constipated. Over time, this backup disrupts the gut's natural rhythm, making bloating a persistent issue. Magnesium plays a crucial role in alleviating constipation by drawing water into the intestines, which softens stools and makes them easier to pass. Dr. Bulsiewicz recommends magnesium sulfate, magnesium citrate, and magnesium oxide, as they remain in the intestines longer and help to hydrate the stool. These forms of magnesium are ideal for people dealing with constipation because they work effectively without being absorbed too quickly. Typically, magnesium supplementation starts with a 500 milligram dose taken before bedtime, as it may also improve sleep quality. As the body adjusts, the dose can be gradually increased to 750 milligrams or 1,000 milligrams. However, it is important to consult with a healthcare provider to ensure the dosage is appropriate, as excess magnesium can lead to side effects like diarrhea. In addition to its benefits for bowel motility, magnesium supports muscle relaxation and overall sleep quality, making it a comprehensive solution for constipation and general well-being. Fiber plays a dual role in gut health. It enhances stool movement and nourishes beneficial gut bacteria. However, individuals with gut sensitivity might experience bloating when consuming fiber. Dr. Bulsiewicz advises starting with small amounts and gradually increasing fiber intake to avoid discomfort. Fiber works synergistically with the microbiome, creating a stronger and healthier gut over time. With constipation addressed, let's now turn our focus to the third major cause of bloating: the role of fiber and FODMAPs in your diet. Fiber and FODMAPs play a crucial role in gut health, but managing their intake is vital for those who experience bloating and discomfort. Fiber found in plant foods such as fruits, vegetables, and whole grains requires the microbiome to break it down, as humans lack the necessary enzymes. A healthy microbiome is essential for fiber digestion, and by gradually introducing fiber into the diet, individuals can avoid bloating and improve digestion. Clinical trials show that as fiber intake increases, the microbiome produces more enzymes to handle fiber, reducing gas and bloating over time. For those who struggle with fiber, it's recommended to reduce intake initially and then slowly reintroduce it. FODMAPs, which include fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, are carbohydrate-based foods that are fermented in the gut, producing gas. However, most FODMAPs are prebiotic, helping nourish gut bacteria, so eliminating them completely is not necessary. Instead, understanding which FODMAPs affect digestion and adjusting the diet accordingly is essential. Dr. Bulsiewicz suggests eliminating dairy and artificial sweeteners to relieve gas and bloating, as these often exacerbate symptoms. The reduction in bloating and discomfort after removing dairy and artificial sweeteners has been observed in many patients, and this simple adjustment can lead to significant improvements. Now let's shift our focus to histamine, a compound that can significantly affect gut health. Histamine intolerance is a complex condition where the body struggles to process histamine, a naturally occurring compound involved in various bodily functions, including digestion. While histamine is essential for health, an excess can lead to symptoms such as gas, bloating, skin issues, headaches, and even wheezing. Histamine can come from both internal production and certain foods, especially those that are fermented or aged, like alcohol, yogurt, chocolate, sauerkraut, and fish. Plants like spinach, tomatoes, avocados, and citrus can also be high in histamine and problematic for individuals with intolerance. Histamine intolerance often stems from a compromised gut, where a condition called leaky gut or increased intestinal permeability allows histamine to enter the bloodstream, triggering symptoms. Dr. Bulsiewicz explains that the key to managing histamine intolerance is to support gut health. Supplements such as quercetin can help manage histamine levels by stabilizing mast cells, which release histamine. Moreover, healing the gut barrier is crucial to reducing histamine absorption and preventing systemic reactions. The symptoms of histamine intolerance can be easily dismissed by traditional medicine, as symptoms like bloating and headaches are often treated separately by different specialists. This fragmented approach can make it harder for patients to get a correct diagnosis, which is why a holistic approach is necessary to address the interconnected symptoms of histamine intolerance. For anyone dealing with these symptoms, it's essential to ask the right questions and consider the possibility of histamine intolerance as part of the overall health picture. Lastly, belching is another important digestive issue, and it's primarily caused by swallowed air. Belching doesn't involve air produced inside the body, but rather air that's swallowed and then released as a burp. This may sound surprising, but it's important to recognize that belching is caused by air that enters the body through activities like eating too fast, drinking carbonated beverages, or even chewing gum. The condition known as Aerophagia is characterized by frequent belching throughout the day. Individuals with this condition unknowingly swallow air before they belch it back up. This is often a behavioral issue, and many people don't realize they're doing it. It's a sensitive topic to discuss, but it's important to be mindful of this connection. Common activities that can introduce excess air into the system include using straws, chewing gum, or drinking carbonated drinks. Each of these actions can result in air being swallowed and eventually released as belching, which exacerbates bloating and discomfort. Dr. Bulsiewicz expands on the importance of being aware of these behaviors, emphasizing that if someone already suffers from gas and bloating, they should be particularly cautious about adding more air into the system. Drinking carbonated drinks and chewing gum, for example, introduces gas that either comes out as a belch or as flatulence. Interestingly, he also highlights how fast eating or drinking can contribute to the problem. Aggressive eaters tend to swallow more air due to their hurried pace, which can worsen gas and bloating. Another important connection is between eating rate and metabolism. Eating too quickly can not only increase air intake, but also negatively affect metabolism. The slower and more mindful one eats, the better it is for digestion and overall metabolic function. Dr. Bulsiewicz also mentions that stress and anxiety play a role in belching and bloating. People who are anxious tend to breathe more shallowly, which can lead to swallowing air involuntarily. In terms of treatment, Dr. Bulsiewicz brings up medications like Bulsiewicz, which have been shown to help with cases of Aerophagia. These medications, originally designed for mood disorders, can also support gut function and reduce the incidence of excessive belching by addressing the behavioral aspects of swallowing air. Many people with belching issues don't realize the underlying connection to their gut health, but with the right interventions, it's possible to manage these symptoms effectively. To wrap things up, managing digestive discomfort requires a holistic approach that addresses multiple factors. Each of these elements can contribute to uncomfortable symptoms, but by recognizing and understanding the root causes, we can make meaningful changes to improve our digestion and overall well-being. From adjusting your diet to managing stress and eating habits, small tweaks can make a big difference. Thank you for joining us, and remember, understanding your digestive health is the first step toward feeling your best.